we are delighted to have with us this year very extraordinary speakers. One of them is Nelly della Schiava from the University Hospital of Lyon. And she gave an excellent presentation about ischemia induced from vascular access. So what's your strategy? How are you dealing with this patient, Nelly?
So there are many techniques to treat the HAIDI syndrome. It depends principally from the flow. The first thing to search is the flow on the duplex ultrasound. So if there is a high flow on the fistula, first we have to make a reduction. And if there is no high flow, it's a technique for the end revascularization. The important thing is it's a dual objective, because if we have to preserve the end, so it's an end rescue, and conserve the access in the same time. It depends also on the type of fistula, proximal, distal. It's not the same techniques.
Before a few years, so many years, the main operation we were doing was drill, distal revascularization, interval ligation, and I have the impression we're doing more proximalization these days. Do you have any preference? Are you doing any of these operations, drill versus PI?
No. Drill is the good intervention for the no high flow fistula, but if there is a high flow, we have to reduce. So bending, proximalization, distalization is a good technique in the first line. So drill is only if the flow is low, but it's a technique which is there is more literature. There is a meta-analysis with many patients, whereas for the other techniques there is only short series and few literature.
Perfect. Thank you, Nelly.
I think the best is the prevention. Because it's a severe syndrome, so we have to do all our possible to avoid this syndrome for the patient.
I think that's a very good point. Preventing is always better than treating. And with that, I want to thank you very much, and make sure you join us next year if you want to learn more.